Okay, guys, I'm going to do something which is really a really bad idea because I'm probably going to mess up the whole camera thing, but I want to show you the people in the room. Otherwise, you think it's just Tony and I, and it's a fake news. So hold on a second. Okay, I have to remember this. Say hello. Hi. Okay, are we ready to start?
I think so.
Okay, let me start. Can you pass me that book, please, behind you? Okay, let me start. You know me. I'm Diego Ventura. I'm the CEO and founder of No. And I wanted to start by welcoming the group from Italy, and led by Professor Federica Belfanti. So this is a delegation from the University of Newark, near Varese, right? Yep. And we're happy to have you. Thank you for making the time. I know you have been visiting other companies and you're going to visit some more, so that's great. I want to recognize again Professor Federica because not only she is the leader of the delegation, she's a professor, she's a researcher. Oh, sorry. Sit down. This is the kind of people. These are my friends. But no, I was saying very importantly that Federica is a researcher and also a published author. So again, thank you very much for coming, Federica. No problem. Okay, great. Then we're going to have basically 3 quick sessions with different speakers, and hopefully team from Italy. I mean, this is for you. I mean, I would have loved to have an opportunity like this because you're going to hear from really leader in the space. Have you ever heard of a company called Cisco? Yeah. But one of the speakers is somebody that worked with John Chambers from the very, very beginning. Have you ever heard of a company called Oracle? One of the speakers is a person that worked at Oracle and maybe what it is today. So it's going to be, I think, great. I would have loved it. But let me start. So there is going to be a little session that is more for around public services, so government agencies. And so for that, we have Serenity Thompson. You can see there on the left. She has a great experience in digital marketing, but I want to give you, for each of these people, something that will embarrass them a little bit and also make them very memorable, because otherwise, okay, great expert in digital marketing and everything, we remember it, but then I remember, Serenity, one time you told me that you want to set up a jazz club.
That's right. Now that I live in Sacramento instead of the Bay Area, I think we need a jazz club here. So
okay, fantastic. Okay, great. So that's I think very memorable. Austin, how are you doing today?
Ciao, Diego. Thank you for having me. I'm doing well.
Okay, excellent. So I love to have Austin on because working with the government is not easy, and he's an expert at knowing all the ins and outs. He's with a company called Avere, who is a great partner of ours and a partner that we work with for the project at the DMV of California, which is basically the motorizzazione it would be in Italy. So they're serving 39 million plus Californians who drive. And so it's great to work with them, and Serenity will tell us more about that experience. But in Austin, again, he's the partner that we work with to set up the project. And then we have a session that is a little bit more about support and customer support. And so there we will have David here. David, where are you? I don't see you, but okay. There he is. Fantastic. So Dave, I'll give you the memorable thing that I met Dave, because he'll tell you everything he does. I met Dave at a restaurant called Palermo. Yeah. Dave has been with us from the very beginning. I was really raising funds back then. And I met him through a common friend, Barry Chaffee. And Barry sets up a meeting. This meeting is a restaurant called Palermo. The handle I remember were 2 lupare.
How do you?
Shotguns.
Sicilian style.
I go in, and there is a room that is as big as a tennis court, and there is only one table in the center. And that's where Dave and I met each other, the three of us. A little bit scary, to be honest, but it has been a wonderful. So Lupare, it's Dave. And then Joe Pinto right here, as I mentioned, is actually from Cisco and now at Pure Storage. So when Joe left Cisco, it organized a little party. And for everybody that participated in the party, there was a little espresso cups that said, we have each other's back. And I still have that.
Good, thank you.
And it was, and there were about 500 of these cups. So lots of people saying hello, goodbye to Joe, who is a legend in the space. And then we have Andre, who's also an executive from Toshiba. And, I remember one thing about you, Andre. You remember you guys got a Toshiba, this old table for a conference room? Do you know what I'm talking about?
Yeah, definitely. It was
Yeah.
it was a huge table. They asked us to buy. We had a huge conference room, and to buy a conference table, it runs like $300,000-$400,000. It was that big of a table. So we found the table. The company was going bankrupt. They had it cut into 4 or 5 pieces, and it was sitting there, and we got it for like something like $20,000. And my team got there. We got a truck. Company didn't want to do this, but after we did it, it looked like beautifully done. And it was one of the biggest conference rooms where the CEO and GM from the other building would come over, have meeting in our building. In that
Yeah.
room.
No, guys, I don't know there is a pattern for me and tables. So either at the center of a huge room or the tables are fantastically big. So one of the things. But that story reminds me, one time I went to Amazon headquarters and I see these very old rough tables. And I said, my God, you guys cannot buy tables. And the executive there explained, no, this is from Bezos. It's culturally, he wants to remind us where he started from, because when he started the company, he couldn't afford to buy a table, and so he nailed something together. So interesting. And so, Andre, I think about you when I think about the tables. And then we have Kenny Wong. What is Kenny? Kenny, okay, so Kenny is the healthcare panel, and I'll let him again explain, his background. But what's memorable to me, sorry, Kenny, is when you told me, let's make babies. He was an advisor of mine in the healthcare space. And what he meant is that an introduction to an IVF clinic that now is one of our best customers. And Dr. Amy is the doctor running that. But that's Kenny. So you have a story for everybody: the espresso cup, the table, the babies. And then, of course, Will. And ciao, Will. How are you doing? Yeah.
Doing great.
Will, we met when it was an entity data, and then again, executive in the healthcare space. But I recently discovered that you teach at Cornell University.
That is correct.
Yeah, no, so fantastic. It's so great to have you here. So I probably took too much time, Tony, but that's my little story for everybody. So there will be a little test at the end.
A little quiz. Perfect. No, thank you, Diego. Appreciate that. And just some background about who we are and what we do. The company is No Holds, and chime in at any time if I'm missing your story. I wasn't there. We've been around for about 25 years, which is a long time for an AI company, and that's what we've been doing the entire time. I believe Diego founded the company in 1999, September. And we've been doing it from the beginning. So we really consider ourselves to be specialists in this space, and really have spent a lot of time learning and making mistakes along the way and finding out, how can you deploy enterprise grade AI safely and enough that it's going to make a real impact for these businesses. So as you heard Diego mention, we've been lucky enough to work with some companies on the Fortune 500, whether that was Cisco, Dell, Sony, McAfee, all these great companies that we've been really lucky and fortunate, and of course through our partners and our friends that have helped us along the way. Yeah, it's a very exciting time to be in AI, and looking forward to hearing from all of you as well. We'll have some time after each of the panels for your questions, and feel free to ask anything. There's no wrong questions. So thank you all for being here.
Thank you.
Thank you.
Sounds good.
And we will start our first session. So this one is going to be, our guests are fully on Zoom. Our government session is with Serenity in Austin. So if you want to stay, you can stay, but this is your time to escape. I'll be closer to the microphone. Can you guys hear me okay on Zoom? Perfect.
Yes.
All right. Well, thank you, Diego, for giving everyone an introduction. So for our government panel, we have Serenity Thompson from California DMV, and we have Austin Schalker from Avera USA. And I prepared a couple of questions today, just meant to be an open-ended discussion. So, you know, share as much or as little as you would like. First question that I prepared for you was, how can public servants build AI literacy and confidence among staff who may be skeptical or unfamiliar with the technology?
Should I just jump in?
Yeah.
So at DMV, we're kind of early in our AI journey in some ways. Obviously, we've been working with No Hold for, oh my gosh, Diego, at least about 6 years, right? So we're not, we're not that new, but there are a lot of expanding use cases that we are looking into. So I think in building that literacy and confidence among staff, especially, those who are skeptical or unfamiliar, requires a human-centered approach. So um, you know, I'll talk a little bit about how we use No Hold later, but essentially, you want to start with kind of a practical, very relatable use case. So, we introduced our staff to like the power of AI through Microsoft 360, or Grammarly, which is kind of a writing tool. Figma is a user experience and user interface design tool. So just explaining how AI is included in these tools that we use to ultimately create a better customer experience or citizen experience. And I think that makes AI feel more like an evolution of their work and not an existential threat to their job. We do quite a bit of tailored training to kind of focus on how AI can be used to bring efficiency to frontline staff, or how AI can better empower policy advisors to make sense of the vehicle code, which is, this thick, and how AI can help uh, sh- uh, recommend a shorter version of a 100-page handbook for customers. We do try to provide learning opportunities to staff. I would say beyond the AI training catalog at the state, because AI is new to the state of California. Even if No Hold has been in business for 25 years and other AI companies have been around forever, it's brand new to the state of California. So we really want to kind of acknowledge concerns, help people understand that it's all about efficiency and public outcomes. So we're making our staff's lives better. We're helping them direct their work in a more focused way with the assistance of this technology, which can do tasks for them, or make recommendations that they would otherwise be doing manually. And then that is a benefit to customers. We really like to highlight case studies from other public sector organizations, and I'll talk about a couple of those later, to kind of show precedence. And then we offer continuous learning where we're partnering with academic organizations and think tanks like UC Berkeley, right, Cal, or Stanford, and we're bringing those, graduate students in as interns or as consultants, and they are working hand in hand with our staff and our leaders too, to explore use cases, bring them to fruition, have various touch points, and learn how to take it further and really make a positive impact on both our work and our deliverables, and then on the customer experience in it for Californians.
Thank you so much. I like what you said about that human in the loop approach. Letting your employees be part of that process to build that trust. So I like that a lot. Austin, what do you think?
That's hard to follow. I appreciated all of that. Touched on multiple points that I had in my thought, but also just to paint the perspective, Serenity is giving a great opinion from being in leadership at the state. My background, I've served at the state in a couple different positions, and now working for a small business where I represent our sales mostly to the state of California, but throughout the public sector. My background isn't IT. It's always been more communications, a senior communication consultant. That's a lot of the work I've done. And so I looked at this question from more of a perspective of kind of what Serenity touched on, is like, how do we work with people? And also having served at the state myself, I understand that not everybody is extremely excited about change, especially when it comes to technology. And as much as I've been enthused about AI personally, and not only working with No Hold, but also utilizing AI in different ways throughout my life, big user of LLMs, specifically chat. It's highly enhanced my work in the communication field. And so I kind of look at it from my experience, but then also, from the communication side, is I think we have to start with emotional intelligence and understanding that a lot of people resist change. And especially in the public sector. And, people like to stick to routines, even I do. And AI can be unfamiliar, but ironically, it's kind of designed to mimic what is familiar, or at least we're trying to get there. We're trying to delete the excess amount of fingers in the AI generated videos and make things seem more normal, right? But we have to meet people where they are. And I would say that not everybody is excited about learning new technologies. Although I was impressed last night, my dad did ask me to download ChatGPT for him, and he's 76. So 76 years old, he was like, "Hey man, how do I get this app on my phone?" And I was like, "Okay, it's going to be more than a 3-minute conversation, but we'll work on it." But we have to keep the education practical and low pressure. And I think, again, Serenity touched on some ways that's being done, and show real life use cases and how AI really reduces repetitive tasks and improves efficiencies. Because when we explain to people that we're not really here to replace anybody, we're not here to attack unions, we're not here to attack public sector jobs. What we're really trying to do is enhance these things, build confidence, and get wins, and give humans the ability to go back to do more specific jobs that aren't just mundane and repetitive. So those were some of my thoughts on how we can kind of get it to be more successful in the public sector.
Thank you, Austin. Appreciate that. And I like how you both touched on that and kind of the day-to-day efficiencies and how it can eventually make everyone's lives better. And that actually leads me to the next question, which was, in at least even just in the state of California, every year it seems like we have many more wildfires and public emergencies. There was a pandemic, a couple years ago that we have not forgotten about. So, in your opinion, do you think AI can really play a role in helping government respond more efficiently or better support their citizens during these times of crisis or public emergency?
Well, for DMV, I think we ultimately are seeing the potential of AI to help us kind of be better at kind of data analysis, eliminating, let's call it hate speech from license plates, moving toward readability at the 5th grade level, performing some of those manual tasks that we already talked about, and then engaging with citizens or customers on a more conversational basis. So let me kind of describe what all of that means. Um, you know, the Department of Motor Vehicles is this, 100-year-old entity that is probably most famous for being the punchline to most jokes about the most unproductive experience or your inefficient um, visit to an office ever, right? We're known for being bureaucratic, red tape, and all of that until the last 6 years. So 6 years ago, we brought in a new director, Steve Gordon, who had been at Cisco for many years. He kind of brought in many of us from the private sector, and certainly brought in No Hold to help unmuddle all of this confusion around DMV, which is essentially, um, you know, using a lot of words to describe something very simple, or creating a lot of friction and points in a process that makes it 15 steps long rather than 3 steps. So what we're really kind of banking on AI to do to help us in conversational AI is just help customers finish what they need to do as fast as possible. We are in a search driven world. We're all, what do I, and now and that started with Google, and now we're with Chat GPT. So we're asking questions of these language models, and it has kind of up the bar for accelerated service. So with DMV and with our smart AI assistants through No Hold, we really seek to enable, I think, ease of use and as lightning fast customer experience for website visitors. So that's how we're working with Diego and his team specifically right now, to use AI assistants and their technology to essentially understand and respond to customers in a very natural, human-like way. And we use that throughout, our website in very macro ways, like on the homepage. How can we help you? Just type it in. Like, you don't have to bother with navigation. You don't have to know what you're here to do other than renew something. Type it in, and we will, service advisor will take it from there. We have, with the help of our AI assistants and Diego and team, not only because of that, but certainly as part of a larger portfolio of tactics like this, we have in the last 3 years increased customer satisfaction from like 2.3 out of 5 stars to 4.2 out of 5 stars. And it is all about just cutting through all of that verbiage and all of the 10,000 screens and pages of content, and simply responding in a conversational way to a customer saying, how the heck do I do something? And in that, we're able to cut costs in the contact center because we don't have as many calls coming. We don't have as many agents needing to spend as much time. So now their work is being able to be up leveled. We improve our efficiency. We have faster response times. I mentioned the improved customer satisfaction already. And we can integrate, as well, our assistants with lots of different other systems that we have. That's one way we're kind of looking at AI is for this, a conversational assistant to then continually learn through kind of reinforcement by the user. Was my answer right? Was my answer wrong? And then just get better and better. And I think that is proving to be very, very good for benefits like reduced cost, improved efficiency, and faster response times. So that's one way. I think there are other ways we're using AI, like, mailroom workflow, and kind of augmenting the human work with more automated work, so that what used to be a fully end-to-end human experience or human-driven experience is now more of a hybrid human-in-the-loop experience where we're having humans step in when the AI is flagging uncertainties, like with document review. And that's giving us efficiency gains as well. You know, our processing of driver's licensing dropped from 28 minutes to 10 minutes. And, you know, document review is now 30 seconds for a document because AI is reviewing it, not a person. So that's kind of how we're looking at it. And again, what are the humans going to do? Well, we've got a whole bunch of self-service applications and end-to-end digital services that we do want to provide our customers, and we're upskilling our workforce to kind of meet that call to action and call to duty.
I love that. I'm really impressed. I haven't heard those numbers yet. So you cut the renewing of the license about a third the amount of time, and then 2.3 stars to 4.2. That's amazing.
Yeah, right. Exactly. Yes, we've been making incredible gains, and I mean AI is one reason for that.
I love that. That's really great to hear. Definitely inspiring that you've made that progress, and especially in the wake of the pandemic, that definitely didn't help. Yeah, amazing. Austin, did you have some thoughts?
And Tony, really quickly before Austin responds, let's let him respond to this question, and then maybe we can move on to the next panel, just in the
Sure.
spirit of keeping on track, if that's good with you.
Thanks,
Okay,
Sarah.
great. Yeah,
Yes.
absolutely.
No worries. Yeah, I'll keep my thoughts short. I think it's interesting because across the board, what AI is doing in the public sector is making things more efficient. I mean, that's what it is. And that's scaled up and down depending on what we're talking about, what department, what the service needs are. Avira is super proud of the work that we've done with the DMV, and I know Diego and No Hold are too. And it's interesting having a communications background, like when the branding will actually catch up with the reality of what DMV's done in 6 years. When the public starts to actually realize what's going on because of so many improvements. For me, though, as somebody, again, who's served in different positions, in 2022, I did a stint with CAL FIRE, helping manage fire debris cleanup. And, I really love to see AI applied in the settings where we're dealing with devastation, whether it's, the wildfires or other emergencies in California, something where, we need to step up quick, come up with a solution and have it have a positive effect. So I think overall what we're talking about is, AI helps process and analyze large data sets faster. I mean, which is what's critical during time sensitive situations. And one of my favorite tools I've seen the state apply AI for is this camera system that CAL FIRE uses to spot smoke throughout California, and they're getting notified on a potential fire faster than somebody would call in and report that to 911. So I always love to use that as an example of something real world. And so it helps us improve decision making and help speed up response times, which is great in these short-term emergencies. But in long-term crises, I see AIs helping us adapt plans and then kind of scale them as we go, which provides more agility. So, Avira, we love to do that with the state. We love to partner with great partners like No Hold to help accomplish that and augment staffing to be able to, support those missions. And we think it's super important. So thank you guys for having me on the panel. I've really appreciated the experience.
Thank you, Austin. Appreciate that. And that's really cool. I didn't know they were using AI to detect smoke. I think that's amazing. And, we still have, at least where I live, these towers that people used to have to stay in for a couple of weeks and watch all day, every day. So that's definitely a job better done by AI.
Yeah, we're going to replace those jobs. We just want to augment the rest. But fire spotters, they're out. Sorry, if that was your career plan, it's not going to happen. Thanks,
Thank you. Thank you so much. Well, thank you, Austin, and thank you, Serenity, for taking the time out of your day and sharing your thoughts with us and with these students as well. So thank you so much.
Thank you.
Thank you.
Thank you.
Perfect. Well, I'd love to invite Joe and Dave over to these chairs over here. We'll get going on our next thing.
Nice comfy chair.
Nice comfy chairs.
By the way, it's
Warmed up.
Joe, because it's alphabetical.
Oh my goodness. Very nice.
Young Joe.
Also, if anyone wants refreshments, snacks, drinks, you can get up at any time. Don't feel like you have to
Don't feel like
stay.
you're trapped in your chair.
Yeah, we're definitely not trapped. All right. Well, thanks for joining us. Good to see you both. I've got a couple questions prepared for y'all, and I'm excited to talk to you. So, you had a lovely introduction from Diego. I hope you found it accurate. And I've gotten the chance to know you a little bit. I'm very new to the company. So you both have definitely a strong support background. So the first question I had for you was, what, in your opinion, what kind of customer issues are best handled by AI, and where does human support still play a critical role?
I defer to the expert.
Well, I think in things that are of volume, that are repeatable, it plays a huge role in multiple areas. One, it certainly helps with productivity. We don't talk a lot about productivity, but productivity fuels wage increases. And when you have high levels of productivity, which is what we get in high tech, it fuels wages and salaries for people, right? Then it frees up time to deal with those things that require emotional support, complexity, training and education of customers. So even though, a lot of times people think of AI as just a total strategy, it's a piece of the total strategy about really supporting customers. You just heard from the folks with the DMV where they're trying to support consumers, but in an enterprise scale. When you think about what they're having to do with hundreds of thousands of users of different skills, it's quite complex, right? So for me, it's about handling a lot of the little things. And then on the bigger things, making it a little bit more easier to find the data, making it a little more consistent to give the answer. But that's where I think it really plays. And that's why the ground zero use case tends to be in HR and in customer support versus somewhere like software development. Not to say it doesn't play there, but that's why ground zero you're hearing, because HR deals with people. Customer support deals with customers, right? Dave, over to you.
What Joe said. I think there's a couple things. So, if you're a real good customer support agent, you don't want to have to be able to reset passwords. You don't want to have to do really easy, dumb things. It's actually like a drain on your brain to have to do that. So the repetitive things that Joe talks about, those are the things that AI are just going to eliminate for humans. So I think, they might not necessarily eliminate jobs today, but they will prevent you from having to hire more people in the future. And there's a lot more people out there today, enterprise, consumer, especially like in the consumer range, where there's tens of thousands of calls a week, a month, a quarter, that people don't necessarily want to have to deal with people. They want to do it on their own. So if they can go out there and have an AI chatbot that can just type in the question and have the answer in less than a minute, they're so much more satisfied. And you'll see that 2.4 to 4.2 that Serenity talked about. So I think that's where you're going to see the majority of it for now. And I've got other thoughts that'll respond to the other questions.
Thank you, appreciate it. Yeah, that actually kind of goes into my next question, which is, to you, how are you going to measure, or are you currently measuring the effectiveness of any AI implementations you're doing or have done? What KPIs or metrics are important for you to look at when you're trying to see, is this AI making the difference that I wanted to? Is it worth it, etc.?
Go first,
Please.
Okay. Me and I know each other for a long time.
Yes.
So in order to really drive a superior customer experience, you really got to look at the metrics around basic things: resolution time, the customer satisfaction of each transaction, right? Which eventually leads to loyalty, which is a different measure, right? The resolution on first contact, because people's time is precious. When they're having to call back in multiple times, you're acting like their time doesn't matter, right? And then, eventually they've made a key point. When you have your best trained people now have to do things over and over again, they do a better job because they do want to be challenged. They do want to learn.
Yeah, and I think one of the things that get missed in the first call resolution and the customer satisfaction is really employee satisfaction, right? Because if you get really, really good technical people, and I know the best technical people I've ever worked with were the ones that wanted the most difficult problems. They came in and rode on their white horse and solved the escalation of the day, right? So having them being satisfied to not have to deal with the repetitive ones that anybody that just came out of school could do, or anybody that just read the manual can solve, having them be able to solve those really raises the employee satisfaction. And my favorite leadership philosophy was, if you take care of the people will take care of the business. So this is one way where you could really, really help the people feel better about themselves. And I think it's something around, hey, my job feels better to me today than it did pre-AI, because I'm able to work on the problems that nobody else could solve and that I was the hero for.
I love that. Thank you so much. You're reminding me of, I just read a case study, I think it was Southwest Airlines, and the CEO was saying he puts his employees first, because if you take care of the employees, they take care of your customers, and your customers just keep coming
He
back.
got that from me.
I love that.
Ah.
They're lots of friends. Thank you. But yeah, that was the main questions I had for you all. But I wanted to save a little bit of time so that if any of the students had some questions, they could.
Please, we're humans. Ask us some questions.
Got some great minds here.
But I have a question.
Yeah.
Thank you.
Yeah, break the ice.
Yes.
You mentioned jobs and how jobs will change the future, of course. In Italy, there is always someone saying that AI will destroy jobs, jobs will change, and blah blah. Okay, but first of all, jobs have always changed throughout the years. So that's something that I think is totally normal for us. And the other thing is, what the question, I mean, is how do you think, what kind of jobs will be more impacted in the future, so we can have an answer to.
Sure. Well, it's an excellent point, because look, in the history of my years in Silicon Valley, when people started doing outsourcing to lower cost locations, people said that's the end of all jobs. That was not true, right? And you've seen that many times in history, right, where people overreact, or the end of union work, like was mentioned. My father was from Italy, came to America, unloaded ships. Unloading ships at that time required 1,000 people. It was dangerous work. It was very manual work, right? Well, automation helped make the work safer, right? Because having 100 men in the hull of the ship was dangerous in case the crane collapsed. And that would happen in New York City. And there would be fatalities, right? So we forget those elements, right? I think we're always faced with the idea that maybe more and more, unlike my father's job and maybe your father or mother's jobs more than ever are getting created and getting destroyed. So the ability to reinvent what you do to add value is more critical. You know, I grew up in an America where people's parents came home from the war, and they were electricians, they were teachers, they did what they did for 40 years. I think we live in a world now where people, they do what they do, but they always have to reinvent what they do. And I think that one of the reasons why you're all getting this amazing education is that you're demonstrating that you'll be able to continuously learn. And if you talk to CEOs, they're looking for people who are continuous agile learners. Sorry to run on a little bit with my answer.
That's amazing. Sorry. I remember Austin mentioned his father asking for ChatGPT, and I was saying to the students the other day that my grandmother, she's 86, she just learned using WhatsApp. Thanks to WhatsApp, she is now able to take and send pictures to her family in Brazil, and she reconnected them. So if she at 86 can learn how to use WhatsApp, I think that we can reinvent ourselves and keep learning.
That's right.
I love that.
Yeah.
And Tony, sorry to interrupt here. Can you also ask Andre one or two of your questions that you have for this session? He's also in our support panel. Thank you so much.
Yes, thank you so much. Andre, so in your opinion, and good to see you, you can hear me okay?
Yeah, just fine.
Yeah. In your opinion, Andre, what kinds of customer issues do you think will be best handled by AI in the future, and where does human support still play a critical role?
Yeah, definitely. I think a lot of it has been said already. Anything that's easy, obviously, we don't want some call agent handling those. Anything that's repetitive, so I can say it over and over again. So for us with Toshiba, when we started implementing no hold technology, we had, I can tell you some of the, Joe mentioned how corporations or big entities, we had 275 call center agents that would pick up the phone, answer the call, and solve a technical problem or customer issue. Uh, the so that's we had 8 million laptop computers that we had under warranty, and those are the customers that were calling us. So there was a lot of calls coming in. So for us, when we implemented, we took out those easy questions and repetitive stuff, like the setting of a password or getting order status information. All that stuff we automated through the chat. We call it virtual help desk, and immediately, obviously, we had to go reduce number of agents we had. We had to reduce something around 30 to 40 agents. We implementing one of the, I think, questions was also in regards to metrics. Number one metrics for big companies and hope for the government entities too is to save money. By doing that, we saved $90,000 per month. So that was the D metric for our management, right? But in reality, we also improve our customer sat because customers got the information faster. First time they got the information. So that was the customer sat numbers, the NPS scores went up. So we had better customer loyalty. So areas where you need the human, you definitely need a human. I still believe you need a human interaction. You're going to have agents that have to be picking up the phone. And those are your complex technical issues, maybe. Those are your emotional customer issues like billing issues, right? If there is a conflict that needs to be handled, you definitely, even today, you need to get it to a person to handle those. Uh, the good part is when you implement this stuff, obviously, in our case, we had three kinds of customer phone agents. We had level one, level two, and level three. Each stage, it got very complex issues to be handled. So level one, we had about 200 agents. Level two, we had 50. Level three, we had 25, let's say. Right away, our level one number of agents we needed, it was drastically reduced. And eventually, more and more level one stuff was illuminated as we progressed. But definitely what happened is that you need to train your level three. In other words, you have to take a level one person, train them into level two to a three. And by the way, they make more money if they are handling more complex human type of interaction information. So that's kind of the where I kind of draw the line. The other way to handle it with AI is that AI should be able to tell you in the interaction, whether it's the chat that you're going through or if it's an audio AI, it should see what the type of questions are being answered. It should probably know that customer and the background, and it should make a decision right away. I need to hand this over to a human agent, right? So you're not stuck in a place where this knowing this person, knowing the type of question is, you're going back and forth and not solving the issue. And that also handles that Austin's grandfather at 75 that wants to talk to a person. When he calls in, they know who he is. Okay, AI, even if it's there are people, they don't want to get a automated answer. They want to talk to a person. We still have those people, and so there's a generational thing, but there's also some people want to talk to a human being. So that's kind of the way I would put it.
Yeah, Yeah, definitely. That makes a lot of sense. And then you're able to save, the time and energy and effort of your level 3 people for the folks that really do need to speak to them, whether it's the issue is very complex or that's just their personal preference. And then the people who maybe don't have a preference or it's a very level 1 issue can have it handled automatically, which is really quick for them.
Yes, and as time goes by, I think AI is able to handle a little bit more complex and more complex, if you will, issues. But a question I would put to the panel and to your visitors is that even if AI is so good that the customer doesn't even know it's an AI, is it, do we still want to let the customer know it's an AI interacting or not?
That's a good question. I'm curious what everyone's responses would be.
Oh, I think you need to let them know. I mean, my premise is that they will find out one day anyway. Just get out in front of it, and hey, look, you can tie it to, want to speak to someone, a premium contract. Want warranty support, you could tie it to a tier of service. But my view would be you would just get it out in front. Okay?
You'd be you would save yourself a lot of trouble by getting out in front of it. Yes, there's no upside by hiding it.
Yeah, by the way, he makes a really good point. I find, look, I work at Pure, which is high-speed storage, mission critical infrastructure. I have 900 people. Most of them are technical support engineers with engineering degrees. I am finding I'm in a race condition to convert level 1 engineers to level 2 to level 3, because the baseline is getting handled. Now, what I've seen is, because we've been in this rush condition, more education, more training, our customer SAT scores, which historically have been quite strong, 91 to 92, that's quite strong. The last 6+ months have been running above 95, which is pretty phenomenal. Now, we do charge for services that we provide, but it's an interesting point where you think about it. Would you tier it, use it for non-premium or for level 1, or how could you use it? But it does make you think about your strategy. Great question.
That's great. What do you think, Andre? What's your perspective on that?
I think if you don't tell them right away, or they have no way of knowing, I would think there's the channel you're going in, probably they know. But if they don't know and they ask the question, obviously you want to tell them, yes, I'm AI. Do you want to talk to a agent? That'd be more than happy to pass that over to you. The other way that you may have customers, and Joe might know this, is that there is something called, obviously, augmented reality. You have technicians in the field with glasses that interact with your agent, the expert in home base, right? So there is like discussions going on with a technician or lower level technician in the field, where you don't have to fly across let's say there's an issue in Italy with one of your equipment, to send somebody over there, the expert, to go fix it, figure things out. You may have a lower level augmented reality kind of glasses that interacts in real time, and AI trying to resolve the issue, if that makes sense. So it's kind of developing out there.
Definitely. And Andre, you mentioned a couple different metrics from your time at Toshiba and what you were looking at when you guys had started to automate. And I heard you mention CSAT, of course, just efficiencies and labor savings. Was there any other metric you think was, maybe not something you would initially think of when deploying AI, but that actually proved to be really important?
Yeah, we had besides the CSAT, we had implemented something called Net Promoter Score, NPS, which is a little bit different methodology. It kind of it's a little bit better, at least in my view, is that it measures loyalty, not just how that interaction went. It's more of a loyalty. Is this customer going to come back, right? That's kind of the from that perspective. Other than that, the CSAT and NPI, it's all really business measures. Is how fast you do it, the wait time reduction, the money savings, all that stuff.
Thank you. Appreciate that. Thank you so much. Well, yeah, thank you all for sharing. Thank you, Andre, Dave, Joe.
What I had the opportunity to to present at the Technology Service Association, right? 1,000 service people in the audience. And I said, raise your hand if you went to college to be in customer support. Not one person, like nobody, right? Yet Joe's got 900, I had 1,000, we had 275 for Andre. So there's a business there, right? And so if you think about using AI to help with that business, and that makes your level 2 people more efficient, your level 3 people more efficient, get rid of the repetitive ones, because one of the things that AI has a really hard time to replace is empathy, right? And so some of the best customer service people in the world have the most empathy for their customers, and customers recognize that. And right now, where the state of AI is, it's hard to get it to do that.
Well, it's a great point. And also you can drive adoption and velocity of your technology or your offering to your customers. Don't underestimate that with the impact on your business, driving adoption, velocity, etc. So,
Thank you all very much.
Thank
you. Perfect. Thank you so much. Thank you all for your patience. If you need to grab refreshment, please feel free to do so. The last session we prepared for you all today is around healthcare. So we have one in-person guest and one digital guest. So Kenny, whichever day you'd like. So I'll move over to one of these. Perfect. All right, Kenny and Will, thank you so much for your patience. Excited to talk to y'all. It's always really interesting. Healthcare is such a unique dynamic because it's very critical. It's very private. It can be very personal, and it's very impacted. So I'm really excited to hear from both of you on these questions. The first one would be, in your opinion, what AI tools do you think are, one, accessible, and two, affordable for maybe these smaller family practices, or someone like Dr. Amy, to be able to improve their patient outcomes on their level?
Go ahead. You start first.
Do you want me to go? Oh, I'll go first. I think that's a great question. I'm going to kind of regress for a second, but I won't get off too much here. I think the response can depend a little bit on the type of, when you talk small family practice. And the reason I say this, for the most part, healthcare clinics in the U.S., they're privately owned either by physician or non-physician corporations. Additionally to that, there's a significant proportion of these clinics that are also owned by an affiliate with hospitals and a health system. And I think the other real key factors that's going to change everything is that we're seeing retail chains like CVS and Walgreens are major players in the retail clinic space now. And that's important because they have available cash to buy AI and to really dominate small family practices in the near futures. With that in mind, some of the items I see, and I'm going to avoid EHR systems. If we want to have a follow-up on that, we can, but I think it's important to maybe not look at that. But there is just a plethora of good products out there, AI-wise, that can help these clinics. I'd say the first one, telehealth platforms. This is really going to make a difference. It's going to allow small clinics to really up their virtual visits, enable them to really have physicians connect with the patients from anywhere, anytime, so to say. Also allows people to grow in these small clinics, grow their footprint without brick and mortar buildings. And if you've ever had to deal with Oshpod in California, that's not fun. And they're so unfun to deal with. I think they changed their name recently to the Department of Healthcare and Information. The other thing is small clinics could really benefit from smart appointment schedule tools. AI-driven scheduling systems that use predictive analytics to optimize appointment bookings. They're going to be ground-changing for people. Also will boost patient satisfaction greatly. And I think a couple other quick items here is clinical, or CDSS, we call it, clinical decision support systems, that really allow AI to provide real-time evidence-based recommendations and alerts regarding patient care that'll be really minimizing medication errors. These systems contribute to improved clinical outcomes, so that's important. And just obviously NLP solutions of any type. Good things around chatbots, virtual assistants, anything that can document and to ensure that patient insights are captured. And a couple quick items here. I really think predictive analytics should still be considered in this game. These tools historically have health data that can forecast patient outcomes and identify, obviously with AI and quantum computing coming, growing quickly in healthcare. Those will be game changers. And then anything you can do around patient, engagement platforms, anything you can do to really, I would say, healthcare is about the patient experience and business growth. Programs like PACE programs, which are very common in California for older people. These programs will really allow to foster patient involvement in their healthcare. These tools will also improve medication adherence and boost overall health literacy. And one other item I think is important is mental health. We're going to see a huge boom in mental health for the smaller clinics. And why this is important, if you look at it, I just saw a thing the other day on Becker's Healthcare that about almost 25% of people in the United States now have what we call an AMI, which is any mental illness. And that's about almost 60 million people in the United States. So that is a growing number that can be really provide a service at the small clinic level to help a lot of people out.
Thank you, Will. You reminded me, I just saw a commercial, not sure if you've seen it, but in state of California, I'm not sure which health agency has deployed this generative AI kind of mental health assistant for younger folks, like kind of kids and teenagers. And it's really impressive that they were able to roll out something so quick. Yeah, the mental health is a big one. Thank you.
Yeah, good point.
Yeah, and I think the things I would add, for context, because I used to see patients many years ago at UCSF, and so, and as a Canadian working in the States, billing was very new to me, and so I think for small practices in the United States, there are these codes called ICD-10 code, which is basically trying to figure out the diagnosis of a patient in order then to bill for the services, which is another code called CPT code. Very archaic, and so I think for small practices, typically what they also need to figure out is how to get paid. And so using AI tools will really help figure out the right billing codes to maximize the likelihood you get paid, so you can actually still continue and help the patients that you want to in the local environments as well. But I think similar to what, Will, you mentioned as well, there's ability now, at least in the United States, there's ability to pull data on any patients within 15 minutes, as long as you have the right relationship. So it's called HINs, or Health Information Networks. And so what you can do now for these small practices, because likely for a patient that's being seen at a rural family office or for a vitro fertilization clinic as well, they're being seen in other places, and it's hard for them to get the data, right? So most likely many of you have been annoyed filling out this clipboard on, oh, what's your past history? Well, that information is available. So really using AI to help pull the data, extract the right insight, so the clinician can quickly see that and actually engage with the patient rather than looking at a computer and figuring out in the 20 minutes or so that they have time to see you as well. I think there's a documentation, I think, Will, that you also mentioned. And I totally agree as well. It's also the patient engagement, especially for small practices. Like I think Diego mentioned, Amy Abasade, who was a customer of mine 15 years ago, another startup as well. For smaller practices, they don't have a lot of staff, right? So they have these patients calling in, asking about X, Y, and Z. So using AI to help alleviate the problem. Oh, when is my appointment? What paperwork am I missing? That would really increase the patient engagement as well, and patient reminders, et cetera, et cetera, et cetera.
Thank you. And kind of going off something you had mentioned earlier, Will, really, it seems like in the news every week, there's something about how, for example, AI is really helping them detect certain diseases really early. And I'm wondering, in your opinion, kind of zooming out on the healthcare system, how do you think AI is going to impact kind of diagnosis and care for people that are struggling with something?
I think that's a great question. It's going to help it. I will say that the most common question I get when I talk to healthcare systems is physicians are not happy about this, to be honest, many of them. They say this is losing some autonomy. But to your question, it's going to improve accuracy. The AI algorithms can really analyze vast data sets, including medical images like X-rays and CT scans. We're going to see that. We're going to see faster turnaround times. I mean, that itself, stat's going to really be stat like we've never seen before. And I think maybe the best item of all, we're going to have early predictions on things that we've never seen before. It can absolutely start to look at, the genetic information that you would have, your lifestyle factors, social determinants of health, predict the risk developing certain diseases, enabling proactive prevention and intervention now. People aren't going to have to wait until, they find out they're stage 4. And there's no worse things when I hear about that. I think the other thing you're going to look at, and you're really going to, over the next year or two, we're already seeing this, is personalized treatment of medicine, tailored treatment plans. AI is going to be able to analyze a patient's unique characteristics, such as genetics, once again, medical history, lifestyles, developing personal treatment plans. And the other thing that I am really optimistic about is drug discoveries. AI is going to be able to really take that to the next level. And I think with quantum computing, we may see things in the next 5 years, things solved, or diseases that are cured that we never thought possible. I mean, we're going to see these ability for to predict drug efficiencies and safety profiles that we haven't had before, that could take years, could maybe take months or even weeks, and maybe someday with quantum computing, days. So I'm very, very optimistic that AI is the game changer in healthcare.
Thank you. I like that optimistic perspective for sure.
Yeah, I think to add to that, I think in terms of diagnosis, totally agree. Like, there are public companies now that are utilizing the imaging space, for example, for breast cancer, like Lunit from Korea, where they are able to use that. It's FDA approved for diagnosis. I think in the near term as well, with the amount of data that's available in any patients, I think Will mentioned like personalized medicine for cancer. One of the issues right now is a lot of these KOLs or key opinion leaders for physicians are very localized, right? They have their gut feeling in terms of what's best for patients. And now with large amounts of data, you can actually use AI to confirm, oh yes, for brain cancer patients, maybe using this medication in combination with the other is best in these scenarios. And there's a way to actually confirm that with large amount of patients' data. So you can actually democratize that and really ensure that every patient in this scenario, no matter whether you're living in Arkansas versus Manhattan or San Francisco, anywhere in the world, you get the same access as well. So I think really ensuring there's increased access and increasing the level of care across the board is also the benefit of AI in the near term as well.
Thank you. Yeah, I think anyone and everyone could look forward to personalized care. Everyone wants to be able to have that one-on-one connection for sure. And yes.
Yes, I have a question related to yours.
Yes.
In the case of AI reading its scans, CT scans, or radiography, what if an AI makes a mistake? I have more analytical questions. How's responsible for that? The doctor, the clinic, or the hospital, or the software developer?
Yeah, so I think well, I can take a stab at you to chime in or disagree with me on this one. So I think so depending on the claim of the product, FDA does have rules on that, right? So there are some providers that does require a in-house pathologist, for example, that would review that as well. That typically is this case. Otherwise, there's also a disclaimer that the treating physician should also confirm that as well. I don't think right now, I'm not aware of any product that actually is direct to consumer in a sense, saying, oh, you don't need any provider, just rely on us. But let me know if you have seen it. I haven't seen it that are direct to consumer.
Yeah. No, I haven't either. And you hit it right on the head. You said exactly what I was going to say. Almost all the products that I've seen are AI with a physician at the end of it. So you are using the product. However, a physician makes the final call at the end. As long as you can do that, you can skip over a lot of the rules and regulations, which are thick within healthcare, and save yourself a lot of issues if you're an AI, especially a small AI manufacturer or solution provider. So will that change in the future? I think that's going to take a long time. We have a lot of ethical things we need to look at. Insurance companies around denials I'll have to look at. And then just, trust with the physicians is really where it's going to be. And that's been one of the biggest holdups in healthcare to begin with, is around trust.
Thank you. And I appreciate that question so much, because my last question was, how do you address, this concern of ethical use of patients' data and their privacy while also reaping all of these amazing benefits that are now possible with this technology?
So I can take a stab at this.
Please.
At XCures, we also work with covered entities, or basically our customers, our patients that have a treatment relationship with patients as well. So really ensuring that you have the right agreements, right, with OpenAI or Google Gemini or others, to really ensure the data is federated such that they're not actually incorporating the PHI or patient health information data back into the learnings. I think that's one as well. I think also another way to do that is also de-identify all the information you're sharing back with the AI, which is also something that we also do at Excuse as well for some of the customers. I think the other thing is also the training of the data, right? Which is not new to AI. It's also applicable in the next generation sequencing space I was at, in the DNA space I was at a decade ago too, right? You really need to ensure you're using the training data set is applicable and applicable to the patients you're treating as well, right? So I think that's also very big as well. So if you are treating the US population, for example, you really ensure you have Caucasians, African Americans, Asians, Hispanics, like really representative of the US population. You can't just train it on like a small data set because it's not going to be applicable. I think that's also something that's important as well. And I think the other thing is also human oversight. So you really ensure there's quality as well, because as we know, especially with Gen AI or large language models right now, there is occasions where it's going to hallucinate. And also when you're updating a model as well, you really ensure that you're providing the high performance scores, whether it's sensitivity, specificity, F1 scores. So really ensuring that you have some cadence of quality controls, which is not new, by the way. It is applicable in the diagnostic space as well. So really something that this is also important as well.
No, I like that. I'm going to add one thing here to this. I'll add it from, since you really had a beautiful clinical perspective there, I'm going to hit it from a different perspective I'm working on with a group right now. And what we're really looking at are the ethical considerations of artificial intelligence. And what we're looking at are things around fairness. Is AI, it should be inclusive and accessible. AI should not discriminate against individuals, groups, or communities, which was just noted. AI should not amplify any existing bias. We look at privacy. That's one of the biggest problems we have in healthcare, and we're going to continue to have. It's not going away. I mean, I'm not talking just cyber. I'm talking just the privacy part. Systems have to protect the data. They have to uphold privacy rights and the security of the data. And a couple of other things people don't usually think about a whole lot. It's got to be transparent. AI systems need to be open and honest. They need to be explainable. And that might be the toughest part of all. There are so many things that happen with the way AI gets to conclusions that it's black box, we call it. And and who's responsible for that if it's right or wrong? Is there a hallucination involved in there? There's a lot of things to look in there. And people need to understand how these results are produced, so to say. And then we need to have things around accountability, and that is no different than a human. An AI system should be held accountable. And that's going to be tough to do right now because there's going to be errors and there's going to be people who are harmed by that. So how do we get around that? And AI systems need to be subject to risk assessments to prevent harm. And then just kind of a bonus thing here, I would say, is that human safety, environmental stability, I would call it inclusion, moral agencies, value alignment, trust, the big thing, and technical misuse all have to be somewhere put into a bucket. And there's a lot of work to be done at this point. It will get there. We're seeing more countries, and I'm saying countries around the world, who are starting to form such committees to look into this. And I do believe that Washington, they already are looking into this, but this will be fleshed out. It's just going to take time.
I like that. Thank you. We've got to be patient while we figure it all out. Well, those were all the questions I had. If anyone from the audience has a question, be happy
We have
to...
one from the chat, Tony. Sorry.
Yeah, go for it.
So the one that I have here says, how will insurance handle these issues? Personalized treatment, drugs, etc.
I will say that. Go ahead if you want to. I'm just going to say a couple of things. They're going to have to handle it. They have no option. And I know that's a strange thing to say, and I'm going to say it to the same thing that I hear a lot of technical people within healthcare who tell me, Will, this is all going to go away in a couple of years. It's not going away. AI is for real. It's not going away. When you look at the global healthcare market right now, by 2034, they're predicting it's going to be a $614 billion business. So it's growing by the day. Just in the United States, it's going to be 102 billion by 2030. And right now we spend about 24 billion up to 32 billion, depending on who you talk to, just last year. U.S. healthcare market's a $4.5 trillion investment market for a TAM, total accessible market. What I would look at in this is One, in some ways, and I want some ways, in great ways, it will help insurance companies. You're going to see increased efficiency and cost reductions. Insurers are going to be able to automate their tasks just like everybody else. They're going to be able to make claims faster. Their pre-authorization is just a mess in the United States. It's like a $60 billion mess that goes on nonstop. There are AI tools right now that can resolve a good deal of this. We're also looking at data decision making, which is going to allow insurers look at, once again, vast amounts of data and be able to get the right pricing model, something that's continually a problem, identify patterns that can predict healthcare. That will lower insurance costs for everybody. The other thing is, it is not uncommon for healthcare systems to have denials in the billions of dollars. And I know that sounds crazy when you look at some of the large systems like Common Spirit, Ascension. Denials are a very big mess. So anything we can do to clean that up will also help healthcare systems, because most healthcare systems aren't running at a high EBITDA number or profit that you would think of. A lot of them are running either at 0 to 1%, and some are even running negative right now. So this, in many ways, will help things. Another thing we're going to see over the next year, and I don't think there's any big mystery here, Epic has been hitting this hard. They're almost trying to become a clearinghouse in between the insurer and the healthcare system, where they're going to make sure if they can get this pulled off, Judy's going to be very happy. And that's Judy Faulkner. This happens. I mean, she's already worth 5 to 7 billion. She's going to be worth 3 times that. It will help cash flow for hospitals. It will help insurers be able to reduce their staff, keep their cost in check. And once again, the denials are just a bad thing. It'll help with pre-auth. It's going to help the whole process from the time you're trying to schedule an appointment to the time the bill's coming out. And if you stay at a hospital for more than a few days, you can count on a billing error. Insurers already know that. If we can tighten that up, we're going to save a lot of money for the U.S. healthcare system in general. That will be good for all of us.
Yeah, I think so. To your point, well, I think AI has already been incorporated from both the payer side and also hospitals as well to optimize the billing. I think if the question is more around, will AI products be paid by insurance? I think with provider oversight, likely it will probably take time. I'm a little bit more pessimistic from Will, because I did create a CPT code, and it's still to this day, like 8 years later, some are covering, some are not. So I do think it's going to take time. If your question is asking whether an AI product will be paid by insurance. With provider oversight, it would actually reduce their costs, maybe, but it's still going to take a while for that adoption. I do think it's going to be conservatively probably at least 10 years before we actually see more adoption from that perspective.
Yeah, to your point, no industry moves slower than healthcare on change. That used to be that it took 17.2 years to get a change in healthcare. That's quicker now, but to your tenure, I'm not going to argue with your tenure. I am optimistic it'll be quicker than that, but it would not shock me, and I'm not gonna bet you on that, because you may take my money.
Thank you, Will. Sarah, were there any other questions from the chat?
No, I think that was the only one that I had on my side. So the audience can jump in with questions if they have any.
Anyone from the audience? Final thoughts anywhere?
Well,
yes.
One thing is not a question is, from the Italian audience, this might be a little bit strange, because in Italy, medical, there is no medical insurance, even if, I've been living here for 40 years, but when I go back to Italy, I see that Italy is becoming more and more Americanized in this. In other words, if my mother was to have an exam right away, she has to pay. Otherwise, she has to wait 6 months. And sometimes you don't have the option to wait 6 months for it. So I think that the Italian guests should take this, bring it back home, take it back home, because things are changing in Italy as well. In those countries where the health insurance is assured by the state. That's what it is.
I wonder if the two presenters have any opinion, point of view, or information regarding AI, privacy, and so on. Italy or Europe compared to US. Europe has a much stricter regulation in privacy, not just for medical, for everything. If you have an account on Facebook in Italy, you can prevent Facebook to use some of your data. You cannot do that here in the US, right? So I wonder if you have any perspective about differences or similarity
between Europe and US with respect of AI, privacy, and related matters?
Yeah,
I will make one. Oh, go ahead, please.
like I think for me, because for context, I grew up in Hong Kong. I was then went to school in Canada, so I'm Canadian and American as well. So I think my context is like, and we don't have European customers at Xcures, but in my previous stars we had. And I think it's just every country do have their own thoughts and rules. And it's not like I would say one's better than the other. It's just as long as you're playing by the rules. They all do have their benefits and limitations in terms of progression, but I think everybody is trying to do it on the best interest of the patients as well, of the consumers in that case. So I think as long as you understand that and play by the rules, you should be able to optimize your product for different patient populations.
But I was thinking more like if somebody does a model based on European citizen, and the data is owned by the European citizen, can that model be used for US citizens? Yes or no? And what are the implications there? There is the implication of, is the model representative of the population? The same thing you said before. Do we have enough Hispanic and enough people of color and original native people in Europe be represented? Probably not.
Yeah.
So I was wondering about that one, about the relationship between the two. Because on one side, we are all globalized, we all, I just came back from a trip overseas and everybody has an iPhone in a country that probably they don't have the money to put dinner on the table the following day. And yet everybody has an iPhone. So I was wondering, on one side is globalization, on one side there is protectionism, there is privacy, there are those issues. If you have any experience point of view, or
I can only talk about from the sequencing space, like the DNA space, which I came from before. And for context, we have sequenced millions of patients, but we also know their ethnical background. So, for example, for Italians, they have a higher risk for beta thalassemia because I'm board certified genetic counselor. I used to see patients for different risk, and so the data that we would get in Italy, of course, would be applicable for patients here who also have some Italian descent as well. So I think, but again, it goes back to your point, the consent or the agreement allow, what insights are you allowed to extract from that? I can't comment too much on the AI part, but I can definitely comment, like in other healthcare spaces, there are agreements that allow you to extract certain insights that's applicable outside of Italy to US or other populations as well.
Your point of view?
Will?
Oh, yeah, I think you're asking a good question. I will say one thing. The laws are much stricter, believe it or not, for around security and patient information in Europe than they are in the United States, which would surprise people. It shouldn't surprise people that last year, just in the first 6 months, there was about 16 million records that were compromised in the United States. You don't see that so much in Europe. They have GDPR, which actually California has kind of adopted. So California's been very advanced in how they're looking at things. The other thing I would say is that I believe with time this will happen. That was part of the idea originally when EHR systems were put in the United States, is that they would be able to do this globally, United States first and globally. That has not happened. Europe is behind the United States with having EHR systems in. They're going through their big push right now in a lot of areas. I'll also say that that to get better health outcomes, we're really going to have to share things. I do agree, prior comments there. We need to probably have less bureaucracy within the US and throughout Europe to get this done. I will say that in Europe, the healthcare systems do have less paperwork. I've had to do a lot of work, especially in the APAC region, and I've also done quite a work in Canada, not as much as you, obviously, but I've done a lot of work throughout Europe here in the last couple of years, putting in EHR systems. I think that for this to really happen, there might actually be at some point, and I think this is a long way away, there's going to have to be some type of global healthcare system to really share things, and it's got to be more than the WHO, who's been trying to do this for years. It's going to have to really take some effort upon everybody. and some funding that I just don't think countries right now are willing to pay. But I think it's a really brilliant question, and I'm not sure I have an answer to it right now. I guess it's a little above my pay grade.
Thank you, Will. Appreciate that. And thank you for that question. That was a good one. I liked it. Global perspective. Any other burning questions? Otherwise, we'll kind of wrap up our session here. Thank you, Will, Andre, Serenity, Austin, everyone on Zoom. Sarah, thank you so much for moderating. Kenny, thank you for sitting down with us. And Joe and Dave, everyone else, thank you all so much. Thank you guys for coming and listening and learning and sharing your questions with us. We always love to host you. So thank you so much. Thank you.
And I'd like to say thank you to everybody at No Hold for inviting us. This has been wonderful.
Thanks, Will.
Thank you, No Hold.
Thanks, Andre.
Thank you all.